chronic cough, incapacitating fatigue, and night sweats like she's never experienced before.
I was at my lowest point. I was so weak, I wasn't able to open doors. I felt like I really couldn't do anything. Anytime I needed
And you guys will
to
be
do
mad when you
something
figure
that I
out
really
what
had
she
to do, I
has.
would say, please God, help me, get me through this.
Marianne has gone from a size 8 to a size 4. She can barely breathe going upstairs, and she's so lethargic that just walking to class at the local college
I'm thinking
is
it's a
almost more than
cancer.
she can handle.
She was getting to class and she was having a hard time concentrating because she
But
was
I
so
need
tired
to
from
know
the
what
walk from the
body
car.
part it is.
And no doctor seems to be taking her very
Because
seriously.
right now it seems like lung cancer,
Everybody's telling me
but
that I'm crazy,
that feels like
that there's nothing
it's
wrong
too
with
normal
me.
beyond
No one is listening.
misdiagnosis.
She would go to the doctor and, they
Thumbs up on the screen, and she showed us the shadow.
I
And
think
she
it's
said,
Hodgkin's lymphoma.
this is not supposed to be there.
Size of a football growing in her chest.
When she told me that there's something in your chest, it made sense that I'm not completely crazy. She was able to put the pieces together and to listen to me, and that's what no one had done for the past 3 years.
Now, the hospital staff is completely focused on confirming exactly what's developed in her chest. They immediately prep Marianne for exploratory surgery. It's imperative that they perform a biopsy to find out what they're dealing with. But all Marianne can think about is Mark, who is desperately trying to get to her side.
I was actually in Ohio, and that's probably the most helpless I've ever felt. I was having just these irrational thoughts of, is she gonna die before I get home?
Mark walks into the room just as they wheel Marianne in, along with Dr. Andres Ferrero, who has been assigned to her case.
Doctor came in and told her that we have a diagnosis.
Her diagnosis was what we call a Hodgkin's lymphoma.
Hodgkin's lymphoma.
There's the train.
Her diagnosis was what we call a Hodgkin's lymphoma.
Hodgkin's lymphoma is a common type of cancer that starts in the lymph nodes where infection-fighting white blood cells are stored. The lymphoma essentially breaks down these cells, interfering with their ability to do their job. This leaves the body vulnerable, making it possible for the cancer to spread and grow in the form of tumors.
The majority of the time we find the disease in a very early stage. And the problem is that by the time that she was admitted to the hospital, the tumor was about 25 centimeters by 15 centimeters in diameter.
that was what
You
we
have
thought.
this amount of tumor growing in your chest, then that can compromise your ability to breathe, and that's a very serious condition.
She got a little pout on her face, and then she started to smile. And the doctor says, do you understand?
I couldn't help but say, you have to understand that for all these years, that's all I've wanted, for someone to tell me what was wrong with me, and now you just have.
It was a tumor about roughly the size of a football in her chest, and it
They
had
got
compressed one of her
that.
lungs and actually physically moved her heart over. And of course, this explained all the shortness of breath, all the low energy, because, she wasn't getting all of her lung capacity.
In fact, nearly 75% of her lungs are completely obstructed. As for Marianne's other symptoms, 1 in 4 patients with Hodgkin's lymphoma will suffer weight loss, night sweats, and itchy skin.
I felt guilty because I felt like I should have known that
You
there
should've.
must have been something really wrong.
Inside, I would go, it's not fair. She is such a good person. Why is she having to go through all of this? She was so close to death. She has seen that door.
After she is diagnosed, Marianne is immediately transferred to the oncology ward, where Dr. Ferrero begins her treatments.
The good part about Hodgkin's lymphoma is that it's a disease that is extremely sensitive to the treatments that we have developed for that. And that includes chemotherapy, and that includes radiation therapy.
Chemotherapy is a regimen of toxic chemicals intravenously delivered to patients to destroy cancer cells. Used in combination with high doses of radiation, it can be extremely effective in treating some cancer patients. But the treatments require months of follow-up and can cause devastating side effects.
It was the sickest Marianne has ever been. And through all this, I was basically just trying to keep it together.
The multiple treatments shatter Marianne's fragile body, leaving her too weak to even speak.
Having Mark by my side kept me going. Because there were times when I wanted to give up. Since I wasn't talking, I still wanted to communicate with Mark. So I would always say, I love you. So I would just kind of motion to him.
That gave me more strength to deal with what was going on, because it was almost like her reassurance of, I'm in here still.
Finally, after 17 long months of painful recovery, Marianne is declared cancer-free.
One reason I'm kind of bitter towards people that don't believe in the illnesses, or like some doctors, because as you can tell, I'm fine with some doctors in the show, but other times it's just like, no, I do not like them. And the reason for that is, when I was diagnosed with psoriatic arthritis at age 12, my doctor did this. At least it's not cancer. And I asked other nurses and doctors if I could have kids, because I know that psoriatic arthritis is a condition that attacks the joints, and pregnancy will loosen the joints, making psoriatic arthritis worse, which there's now treatment that can do without hurting the unborn child, or will only have little side effects. And the doctor that I got diagnosed with the psoriatic arthritis with said, if I was you, I'd never have kids. What the nurses and other doctors told me is that it's up to you and your future husband if you're going to have kids by pregnancy, which happens to be with Coleman Kevin. I saved his life by telling him that he has blood clots. And in his video, he asked me to marry him, so yeah, he's my boyfriend.
Marianne is declared cancer-free.
When we heard that Marianne was
I'm feeling less stiff from the psoriatic arthritis, and I'm hurting less. I'll bring Coleman back from New York. I'll end the video here.